Okay, students, so this is CAM 445 Microbiology and Chemotherapy, and this is lecture 1, and the topic is pharmacology. And I am Dr. Musaddiq Ibrahim, Assistant Professor, Department of Chemistry, Guwahati University of Science and Technology. And you can find the relevant lectures of your courses at this web portal, which is www.ms.cohort.edu.pk. Okay, so the topics which we will be discussing in this lecture will be including about drug, that what is a drug, difference between drug and poison, pharmacology, pharmacodynamics, pharmacokinetics, and the drug development and approval process. So moving towards that, what is a drug? So first of all, we need to understand that what is the definition of a drug. So any animals or vegetable or mineral substance used in the composition of medicines is referred to as a drug. So it means that if you are using any part of an animal or any part of a vegetable, or you are using any mineral substance which is used for the formulation of the drug medicines, so that will also be referred as a drug. Now, according to the Food, Drug and Cosmetic Act, a substance recognized in an official pharmacopoeia or formulary is known as a drug. So pharmacopoeia is a book in which all the medicines and drugs have been included. So when a chemical, a substance has been included in that book, so it means that that substance is a drug. Also, a substance which is used for the diagnosis, for the treatment, mitigation, and prevention of a disease is also referred as a drug. And also, one of the definition of a drug is that a substance other than food which is intended to affect the structure or function of the human body is also known as a drug. Another definition of drug is that a substance which is utilized as a component means as a part of medicine, but not a device or a component part or accessory of a device. So it means that anything which is a part of medicine, for example, in case of tablets or capsules or injections, you have the active ingredient and then you have the excipients. So the excipients are also referred as drug because they are used in the formulation of that drug along with the active substance, which is also referred as a drug. So these are all the definitions of the drugs. Now moving towards the differences between drug and poison. So what are the difference between drug and poison, and how it is being categorized. So all the substances are poisons. How they are poisons, we will come to know in the coming slides. So there are no distinct borderline between them. So difference between the drug and poison, so there is no exact borderline between the two of them. So any drug can be toxic once it is being taken then more than the normal dose. So for example, a patient is taking an antibiotic and the dose is 250 milligram per day. So instead of taking 250 milligram per day, the patient is being given 2 grams of the antibiotic per day. So then that drug becomes poisonous for the patient. So it is all about the dose requirement. So the normal dose and the lethal dose. So the toxic dose, it becomes the lethal dose, which means that it can even kill the patient. Now moving towards the pharmacology. So what is pharmacology? So the study of how drugs affect a biological system is known as pharmacology. So here in this diagram you can see that the pharmacology, it is being divided into two types or two branches. One is pharmacokinetics and the other one is pharmacodynamics. So the biological system means the human body, and the drugs effect on the human body when they are studied in the branch of science, so then that is known as pharmacology. Now there are two things which are happening in case of pharmacology. So one is pharmacokinetics, which is that what is the body doing to the drug. So what is the action of the human body on the drug. And another one is pharmacodynamics, which is what is the drug doing to the body. So these are two different things. One is that when you take a drug, so what the drug is doing to the body, what is the effect of the drug on the body. So that is pharmacodynamics. And when you take a drug, so that is being metabolized, distributed, and then excreted ultimately. So that is being happening onto the drug by the body. So that is known as pharmacokinetics. So now in pharmacology, in this schematic diagram, we will understand that what is pharmacology and what is happening. So here the pharmacology has been divided into two types. One is pharmacokinetics and the other one is pharmacodynamics. So first of all, when a patient is suffering from a disease or an infection, so he is given a dose, and then first of all the drug is being absorbed. Now then the drug concentration in systemic circulation, which means in the blood circulatory system, and then there is distribution of the drug, so it reaches to the tissue level, and then ultimately when the drug has been reached to the tissues, and then it is being metabolized as well as excreted. So this all is being studied in pharmacokinetics. That is that what the body is doing onto the drug in terms of its absorption, distribution, and metabolism, as well as excretion. So these are also referred as ADME studies. That is, A stands for absorption, D stands for distribution, M stands for metabolism, and E stands for excretion. So all these processes are happening because of the body action on the drug, and that is being studied in pharmacokinetics. Now, when the drug reaches to the target site, then we have the pharmacological effect, and then we can see the clinical response, the efficacy, as well as the toxicity of the drug. So the pharmacological effect is the mode of action of the drug onto the bacteria or any infection or disease, and as a result of using that drug, the clinical response is that how the patient is behaving after using that specific drug. And then the efficacy is that how much drug is required, that is about the dosage which has to be given to the patient. So if a small amount of drug has to be used, so it means that the efficacy of the drug is very good, as well as the toxicity studies, that at what dose the drug becomes toxic to the human body, and these all are studied in pharmacodynamics. So moving towards pharmacokinetics. So pharmacokinetics is the description of the time course of a drug in the body in terms of its absorption, distribution, metabolism, and excretion. So in pharmacokinetics, we are studying that how the drug is being absorbed, then how it is distributed, what is happening to the drug in terms of its metabolism, and then what is the route of excretion of the drug. So these all are studied in pharmacokinetics. And in simplest terms, we can say that what is happening to the drug by the action of the body. So what is the body doing to the drug in terms of absorption, distribution, metabolism, and excretion. So these are all studied in pharmacokinetics. Now moving towards pharmacodynamics. So pharmacodynamics is actually studying the biochemical and physiological effects of drugs in certain time period. So in brief, we can say that what is the drug doing to the body. So actually, in case of pharmacodynamics, we are studying the mode of action of the drug on the body. So how the drug is treating the infection or the disease, and along with the effect of the drug on the body, there are certain other things which are also discussed in pharmacodynamics, which include the drug receptors, the effects of the drugs, the response to the drugs, and the toxicity and adverse effects of the drugs. So in case of drug receptors, So there are drug receptors present on the cells to which the drug binds, and then these receptors, they may make available the possibility of the drug to enter inside the cell where they perform their action. So that is also being studied in pharmacodynamics. Now the effects of the drugs. So as a result of taking drug, there are certain effects which are taking place in the human body. For example, if a person is taking antibiotic for throat infection, so with the passage of time, the throat feels good and the infection is going away. So that is the effect of the drug, which is also studied in pharmacodynamics. Other thing is responses to the drugs. So sometimes the drugs, they are effective, and sometimes the drugs, they are not effective. So the reason is that sometimes there is a resistance being developed by the bacteria against the drugs, and as a result the response to the drug is resistance and the drug is not working. So in that case, another drug of choice is being given to the patient so that the resistance can be overcome. So that is also discussed in pharmacodynamics. Now another thing is toxicity and adverse effects of the drugs. So as we discussed previously, that when the drug is being given more than the normal dose, so then that drug becomes toxic and it has toxic effects on the body, as well as the adverse effects, which are also referred as the side effects. They are also being studied in pharmacodynamics. So the adverse effects of the drugs may be fever, loose motions, reddishness of the skin, pimples, dysentery, and many other side effects which can occur as a result of taking a specific drug. So different drugs have different side effects, and these are all studied in pharmacodynamics along with the toxic effects of the drugs. So now we move towards the drug development and approval. So there are different stages in case of drug development and approval. So the first stage is the preclinical testing. Then the second stage is clinical trials, and the last one is the post-marketing surveillance. So in case of preclinical testing, you do the in vitro studies on the drugs as well as the animal testing of the drugs. So this can take from 1 to 5 years, and this is referred as preclinical testing or preclinical trials, which means that this stage is before the clinical trials, and it involves in vitro study in which you are performing assays in the lab and looking at the inhibition ability of the drug on the different substances or enzymes. And animal testing is normally performed on mice, and first of all the mice are infected with certain disease, and then the drug which is supposed to be curing that infection or disease is given to the mice, and then the effect is being observed. So this process normally can take from 1 to 5 years, and that is being then taken to the next stage, which is the known as the IND, which is investigational new drug. So when the drug passes through the preclinical testing, then it goes to the next stage of clinical trials, and then the investigational new drug terminology is used so that it can be checked for clinical trials. So first of all, in case of clinical trials, the long-term toxicity studies are being carried out. So in case of these long-term toxicity studies, there are three phases, which are phase 1, which includes the normal volunteers along with the safety as well as the pharmacokinetics. So these studies are being carried out on the normal volunteers. Now the phase 2 is the selected patients who are suffering from certain disease for which the drug has been developed and it is being proven in the preclinical trials that that drug is effective against that specific disease. So those patients who are suffering from that specific disease, they are given that specific drug. And then in the phase 2, the therapeutic efficacy of the drug is being monitored, that how much efficient the drug is, as well as the dose range is also being observed, that what is the normal dose or the minimum dose or the maximum dose of the drug is effective against that specific disease. So these all studies are being carried out in the phase 2 of the long-term toxicity studies during the clinical trials. Within the phase 3, the large population of selected patients are taken, and then the therapeutic efficacy as well as the safety in double-blind studies is also being carried out. So that is the phase 3, in which the large populations of the selected patients who are suffering from a specific disease for which the specific drug has been developed is being given to those patients, and then the therapeutic efficacy of that drug is being monitored and observed. So these all clinical trials, they can take from starting from 2 years up to 10 years, which is a long term, and then we reach to the new drug application stage. Now, after these clinical trials, when the drug has been found that it has efficacy, it has minimum side effects, as well as it is effective against the specific disease, so then the new drug application stage is being reached, and which takes about an year. And then afterwards, the post-marketing surveillance, which is phase 4, is being carried out, which means that when the drug reaches to the market, sorry, then it has been observed that how the drug is being performing onto the patients, and what are the side effects, whether the dose recommended for the drug is efficient or not. So all these studies are being carried out in the post-marketing surveillance of phase 4. And this is all dealing with the drug development and ultimately the approval of the drug. So the maximum time, if you count down the preclinical studies, which is 5 years, then the clinical trials 10 years, and then 1 year for the new drug application. So it sums up to about 16 years. And so that is the maximum time limit for the development as well as the approval of the drug. And the minimum time, if you count it, so starting from 1 year for the preclinical trials, then 2 years for the clinical trials, and then 1 year for the new drug application. So it adds up to 3 years in total. So it takes about like 10 to 15 years on average for the development and approval of the drug. So these are the references, and you can go on reading these books for further clearing your concept about the process of pharmacology, pharmacokinetics, and pharmacodynamics. And the Cardzong book about basic and clinical pharmacology is a very good book for further reading and explanation. So thank you, and if you have any questions, so you can write down your questions within the comment section of the Trust Media server, which is www.ms.cohort.edu.pk, and I will answer your questions there. Thank you.